What's your dog afraid of? Tulip here is afraid of veterinary visits. She's afraid of strangers, and she's afraid of the UPS truck. If your pet, dog or cat, is afraid of something and their symptoms are concerning you, you got to watch this interview. Welcome to our Fear Free Friday Expert Series for our annual Pet Anxiety Awareness Campaign. Now, today's guest is a real treat for both you and I, and for our pets, of course. He's one of only about 100 board-certified veterinary behaviorists in the world. And you and I have an appointment with him today to learn more about pet behavior, how it affects our pets, how it affects our families, and most importantly, what we can do to help our pets. Now, if you're new here, I'm Kristen Levine from Pet Living. I'm kind of like a pet parenting coach. I help you solve problems, find products, and meet great experts who can help you and your pet live your best lives together. So, with all that said, welcome to my guest today, Dr. Chris Pachel. Welcome.
Thank you so much for having me on today, Kristen. It's a pleasure to be here and engage this conversation. When it comes to people living happier and more fulfilled lives with their pets, I'm here for it. So thanks for having me on.
Of course, of course. And, you are not only a board certified veterinary behaviorist, which I'm going to have you explain to our viewers in just a minute, but you also have an animal behavior clinic in Portland, Oregon. And you also, you're a busy guy. You teach veterinarians about behavior. So I just want you to know how much we appreciate your time, because you've got a lot going on. So why don't we start off with the question you get asked so often? Tell us what it means to be a board certified veterinary behaviorist.
Yeah, so like the shorthand version is I'm sort of like a psychiatrist for companion animals. That's probably like the easiest way to think about it. It's bigger than that, but that's kind of the shorthand. The thing I love about being a veterinary behaviorist as opposed to a trainer or a behavior consultant, which I also have certifications in, but the veterinary piece allows for a unique look at not only the behavior and the emotional state of the animal, but actually a more comprehensive understanding of how that's impacted by the physical health of the animal. So when we're looking at the influence of pain or hormonal conditions or those sorts of details, we really get a comprehensive look at all of those details.
Yeah, that's a great explanation. And because there are only 100 of you, help us understand when, for pet parents, your pet, dog or cat are experiencing symptoms of fear, stress, and anxiety. How do you know when it's time to contact a veterinary behaviorist as opposed to your regular family veterinarian or like you said, a certified animal behavior consultant?
Yeah, so there's not a hard and fast rule there. Generally speaking, though, starting with your primary care veterinarian, especially if you're observing a recent change or a significant worsening of behavior that doesn't have an obvious explanation from a behavior standpoint, checking in with your veterinarian, doing a physical exam, probably running some baseline diagnostic tests as well, just to make sure, knowing that some of the things that can cause behavior changes aren't always going to be visible on a physical exam. So starting there is a great place to start. If your veterinarian doesn't know what to do beyond that, by all means, they can reach out to someone like myself and we can do a consult, even at that level, to say, hey, what's going on for Sparky and their people? And so we can do it that way, or the client can reach out to a veterinary behaviorist directly when they're looking for that comprehensive toolbox, either at the start of that journey as they're navigating something that's going on in their household, or maybe it's as an escalation point when they've worked with a trainer, they've consulted with a consultant, they're chatting with their veterinarian, they've done the physical exam, the pieces just aren't coming together. That's usually where I come into play.
Okay, gotcha. That's very helpful. I have to say, when I was prepping for this interview, I was on your website yesterday, and I just love what your website says when you get there on the homepage. It says that you're transforming lives through behavior modification, education, and kindness. And so I wanted to have you talk to us a little bit about your philosophy around treating animal behavior.
I love that you pulled that tagline in. It was something that I sat with for a really long time to say, how do we really express what we do? And that kindness piece is so important, especially when we're working with behavior issues that can be really, really damaging to that human animal bond and those relationships within families. There's often a lot of guilt or shame or criticism surrounding some of those issues. I should have done better. I could have done some. All of that judgment can creep in. And so going to a professional who layers on additional criticism, blame, shame, and judgment is not going to be helpful for anybody, including
Right.
the animal. So I
Right.
really, really strive to say, hey, let's ask some questions. Let's figure out to the best of our ability, as efficiently as possible, what's going on. What's
Yeah.
the dynamic? What's the environment? Who are the players in that story? Let's figure that out. And then let's meet that animal and the people where they are. And let's figure out together, what are those next tangible, practical, actionable steps that we're going to be able to take to move forward, either to really address the issue or even to gather some additional information to say, hey, let's try this. And then what happened? And we can start to peel back the layers of that onion to really understand what's going on at a core level and really address it at that fundamental basis.
Yeah, I love that approach because, I often hear from people who are just they're very frustrated by their animal's behavior, and they don't understand what they're doing wrong, or, what they should be trying. And it really is such an individual approach. There is no one pathway for every pet, right?
Yes,
Dog,
you're
cat,
absolutely
whatever.
right. And I love the way you said that. It's not inherently that any particular intervention or solution is inherently right or wrong. But
Hmm.
when you're working as the pet parent with that N of one, that animal in front of you, if you don't yourself have that entire comprehensive toolbox, it's really difficult sometimes to know which strategies to pull in or how long to do them, or even understanding what a clinical treatment response might look like. Right? If you
Right.
don't know those details, it's really lonely out there on that road to try to figure out what to do.
It sure is. Can you talk to us a little bit about what behavior modification means?
Yeah, so behavior modification is a little bit different from your kind of your standard training approach, where we're taking a naive animal and we're onboarding certain skills like come, sit, down, stay, or some of those sorts of things, right? Great skills, they have a place. But when we're talking about behavior modification, we're usually layering that on top of a situation or an animal or a behavior pattern that's not as functional or perhaps as safe, or
Hmm.
isn't a really reliable coping strategy for that animal to engage in. So we are stepping in to say, hey, let me help you. Let me onboard a different emotional response or a different way of dealing with that situation, sometimes through training and alternate behavior, but even by saying, hey, let's seek first to understand, and then we can modify what's going on, either by modifying the environment in some cases to set that animal up for success, or
Hmm.
perhaps going through some dedicated training exercises, sometimes supporting with medication or other adjunctive therapies to really smooth out that process. But it's really about providing that level of support for what I consider to be our kind of target market. And that's usually animals with big feelings and insufficient coping strategies, right? That's
Oh,
who
I
we're
love that. I'm writing that one down. Big feelings. And what was the second part?
insufficient coping
Inso-
strategies.
I love that. That is the best definition I've ever heard. That's fantastic. That really paints the picture.
And that's it, right? And whether it's a dog or a cat or a horse or a parrot, or, outside of my purview, but a child or a spouse or a family
Yeah.
member or another human, right? That's often where we struggle. And there's all
Yes.
sorts of things that go on in the brain in terms of the way our brain responds to stress and arousal and how it influences cognition. Whew.
Hmm.
All of that is so important to understand.
Right. Now, I assume that the most people that are watching, they're like sticking around for this interview, are probably already, they know for a fact that their dog or their cat has, some big feelings. And but I also I want two things I want to address. First of all, how how early should you talk to your vet about symptoms your pet is exhibiting that are concerning? Because my 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 thinking is that when at the early onset of these big feelings, before they become big feelings, when they're just kind of little feelings, I think all too often we might think of them as cute, or we just kind of discount them. So can we talk a little bit about how diligent we need to be in terms of understanding our pet's behavior and any changes there as far
Yeah.
as preventing the big feelings from getting bigger?
Yeah, I love that as a place to start. And there are certain things that we recognize, right? That puppies or kittens, for example, are going to go through a lot of developmental changes, and some of those changes can be very appropriate. Even some
Mhm.
of the, well, I'm going to say the bigger feelings that happen on the early side of the teenage months, right?
Yeah.
For both of those species, where the brain is changing, it's remodeling from the inside out. So sometimes those big feelings are actually somewhat appropriate. But
Mhm.
it's really difficult to know sometimes whether that's actually appropriate or normal for this species, or even if it
Yeah.
is normal, it still could be pretty darn problematic. So honestly, the moment someone says, I wonder what's going on here, to me, that's the first moment to send up a flare. It's the first
Yeah.
moment to start asking those questions. I sort of have a love-hate relationship with Dr. Google, but there's a lot of great information out there, right? And so it
Sure.
is important even just to start gathering a bit more information and then fact checking that with your pet's veterinarian to say, hey, what do we think's going on here? And hopefully they're in a position then to either guide additional diagnostic tests
Mhm.
or to say, you know what, I don't think that's a medical issue. And I know this positive reinforcement trainer who's a certified behavior consultant.
Mhm.
I'm going to match you all up and let's start there. If we're not seeing the response you're looking for, then by all means, let's circle back around with that additional information. And that
Right.
may inform our view on the medical side just a bit differently.
Gotcha. Okay, then on the other side, where the folks watching who perhaps their dog or their cat already has these very big feelings, whether it's around loud noises, separation, generalized anxiety, how would you obviously we can't consult them without understanding their situation, but how can we set expectations for either resolving the problem or managing the problem so that it becomes less of an impact on that human animal bond?
Yeah, it's an important thing to look at, especially when we're looking at some of these things that result from fear, anxiety, and stress. Knowing that those are actually normal, biologically appropriate emotional responses, right? I'm not going to
Yeah.
pathologize all of that and say, oh my gosh, we must eliminate all fear. Like, it's not the way life works.
Right.
However, when we see those fear, anxiety, stress, or arousal or frustration responses that are starting to impact that pet's ability to be safe or comfortable, or
Hmm.
maybe have a brief stress response but recover back to a normal baseline, the moment those emotional issues start to creep beyond that, the impact can be pretty significant. And so we really want to
Sure.
make sure that we're doing the best we can to put some form of treatment around that, typically to reduce the frequency, the intensity, or the improving the recovery after those reactions. So again, kind of blunting the frequency and the intensity, or
Hmm.
improving the ability for the animal to just give a big shake off
Yeah.
and get back to
Take it off.
normal. Right. So
Right.
that's what I really try to help my pet parents understand, is that we're not necessarily saying eliminating or curing, but we definitely want to get back to what we would consider to be a normal expression of all of those emotional responses.
Got it. That's really helpful. I'm going to do a little bit of housekeeping real quick. I'm going to we've developed a calming solutions guide for pet parents for this month, and you can get it free at petanxieityawareness.com. It's a free download. We've got tons of great resources in there: how to find a veterinary behaviorist, when to talk to your vet about the symptoms you're exhibiting. We've even got some partners that have joined us that we're going to talk about in just a second, who have helped make this whole campaign possible to educate pet parents about how we can help our pets. So be sure to download that free guide at petanxieityawareness.com. And Doc, now what I want to talk about is, well, first, before we dive into this particular product that I've discovered recently that I find fascinating for dogs, specifically with separation anxiety, but perhaps it could help others as well. What are the most common uh, cases that you see in your practice with dogs or cats or both?
Well, you mentioned one of them already. So separation related problems is absolutely something that we see very frequently within the practice. It's a really, really common problem. Estimates vary, anywhere from 14 to 17% of the population, up to some numbers and some estimates that are significantly greater than that. So it's definitely a common issue. We also see a fair amount of other fear-based behaviors, whether that's fear or defensiveness associated with handling or certain social interactions. We also see noise phobias or noise sensitivities, noise aversions, where we have that more of a panic response to environmental stimuli, things like noises or acoustic stimulation. We also see compulsive behaviors or patterns related to elimination disorders, perhaps cats who are urine marking or who are soiling outside of the litter box within the home. And then we see a lot of dog to dog and cat to cat and dog to cat and all sorts of mixed species patterns as well that we need to sort of unravel and address.
So never a dull moment at work for you.
There is never a day that looks exactly the same like any other. And even when we diagnose the same pattern 5 times in a row, it shows up differently with breed and species and household and owners and all of that. So it keeps me on my toes.
Goodness. Okay, well, let's get back to what you were talking about, separation anxiety. I think that's something that I think you said approximately 14 to 17% of dog. Are we talking about dogs specifically with that statistic?
Dogs specifically for that statistic. It does happen in cats as well. It's less common, but it definitely occurs in the feline population too.
Okay. So one thing I want to talk about, and certainly feel free to take us in any direction you'd like, but I wanted to talk about some of the drug-free solutions that we feature in the Calming Guide. And this year, joining us for the first time this year is CC's Calmer Canine treatment system. And actually, I have a picture of it. Let me find this picture. And let's talk a little bit about how this works for dogs with separation anxiety. And have you prescribed it or used it in any of your patients?
Yeah, it's actually a really cool innovation that's only been with us for a couple of years now. Now, the technology behind that particular device, it relies on what's called TPEMF, which stands for targeted pulsed electromagnetic field. And so those signals are delivered to the body, right? And so when we're talking about the Calmer Canine Anxiety Treatment System, it's that little halo that sort of sits right behind the base of the skull that delivers that signal essentially right into the emotional control centers within the brain. And it's been shown to help regulate and sort of recalibrate that area of the brain as a way to help those animals who are struggling with those big feelings issues. It's been specifically studied for the adjunctive treatment of separation anxiety. And we can go into that in a little bit more detail, but it's definitely something that we're using. I do recommend it in the practice, not only for separation anxiety, but also for the adjunctive treatment of other things like noise aversions or generalized anxiety patterns as well in dogs.
Okay. Yeah, and I have one right here, and this is the little vest. Well, this is a big vest actually, but they have the vest in multiple sizes, and then this is that little halo. And it's so simple to use too. You just press this button. It comes with a battery already in it, and it delivers the therapy. Speaking of which, I think I read they recommend 2 times a day for 15-minute periods, and doing that for a period of about 6 weeks.
That's exactly right. Typically 2 treatment periods per day, roughly 15 minutes, approximately 8 to 10 hours apart is the ideal. A standard course of treatment is usually from 4 to 6 weeks long. And then we see how much sort of bang for the buck or how much return on that time investment we've received. Some pets will benefit from longer treatment, and some will show improvement in as little as a couple of days. So it's not that we have to wait the full 4 to 6 weeks to know if we're seeing some traction. It often takes effect a bit faster.
Interesting. And is the idea that after that 6-week period that you don't do the therapy anymore, or is it that's how long it would take to start to see the results?
So it varies a little bit from dog to dog. Some of the patients that were treated within the initial study, both the pilot study as well as the placebo-controlled actually intervention study that we
Yeah.
have available for us. In those scenarios, some of them did not require additional treatment beyond that,
Hmm.
whereas others, we may see a period of time, especially as life's stressors may start to creep back in again. It may be helpful to do a repeat course of treatment to get things back online again. So that
Right.
it's a little bit hard to say exactly,
Yeah.
but it's not out of the question to think that that single course of treatment could be effective for a very, very long time for some of those dogs.
That's really cool. And I would assume, and correct me if I'm wrong, so if you are using the Calmer Canine treatment system, that would also, for separation anxiety specifically, that would also be paired with behavior modification. Is that correct?
In the ideal world, yeah. So one of the things that
Yeah.
we're really trying to do, especially with something like this, as an alternative or an adjunctive along with other medications or supplements or pheromones or some of those other strategies, is we're trying to reduce the influence of those big feelings that are sort of coming out sideways with some of those patterns like destructive behavior or excessive vocalizations or
Mhm.
hypersalivation or any of those other patterns. So we're trying to reduce the emotional impact. That doesn't automatically
Mhm.
teach the animal how to cope, right?
Right.
But it's a huge, huge step forward. So we're often pairing it with even sort of a basic level of intervention there, avoiding leaving the pet alone longer than what they're comfortable, teaching some
Right.
independence within our interactions, and so on. All things that we can do and we can incorporate for our clients, even within busy lifestyles.
Got it. Okay, so let's shift gears a little bit and let's talk about noise phobia, because while it's not a seasonal condition in our pets, it's certainly more challenging around holidays like July 4th, New Year's Eve. And, I don't know when this whole trend started of starting fireworks like the week before the holiday, but we used to only worry about it the night before. Now we have like a whole week before where people are like, shooting off fireworks. And for those of us who have had dogs specifically with noise phobias, we don't enjoy the holiday at all because we're so stressed about our pets uh discomfort and fear. So because we have one of those holidays coming up pretty soon here, can you help us prepare our pets for that holiday? Because I know you don't want to wait until the night before, right?
Exactly, exactly. And and then when we're talking about noise phobia, certainly the most common noises are things like fireworks or perhaps
Mhm.
severe thunderstorms, but any loud, unexpected, unexplained, sort of challenge to that pet's perception of safety in the world can trigger that sort of panic response. So, while we again often think about fireworks, it can be much broader, especially in parts of the country here in the US that have thunderstorm seasons,
Yeah.
and those storms are daily for weeks or months at a time. It can be
Hmm.
really, really challenging to help those pets navigate. And so some of the things that we're thinking about are typically, well, buffering to start. What
Hmm.
can we do to reduce the intensity of that experience? Sometimes that's blocking visual reminders by closing blinds or creating acoustic blocks.
Hmm.
Sometimes we'll use brown noise or white noise or purple noise or black noise or any of those noise
Uh-huh.
options to, again, buffer or create a bit more of a calming sensation for them. In addition to the buffering or the avoidance, it's also possible for a lot of our pets to teach them coping strategies, either by preconditioning a relaxation response that we can use to actually help them take a breath and settle in, or
Okay.
perhaps pairing some of those noises with something the pet enjoys. So when we hear a
Hmm.
little bang, pop, whistle, and the pet alerts, if we were to toss a small handful of their favorite treats on the ground,
Ah.
we start the process of some kind of reassociating that conditioned emotional response. Noises predict something amazing happening. Noise,
Hmm.
amazing, noise, amazing. Then we
Right.
start to condition that, right? We can't
Sure.
necessarily do that in the full intensity, 4th of July, worst of the worst scenario. It's going to be really hard
Right.
to do that. And if you've got a pet who is that severely affected, definitely talk with your veterinarian about which solutions may be relevant. And one last thing I promise is we're actually learning more as we do additional studies that, especially for pets who are more significantly affected by noise phobias or noise aversions as they start to get a little bit older,
Hmm.
chronic or acute pain can
Mm.
absolutely increase that. So if you're seeing a worsening problem in your dog, especially, but also in other species, another
Mhm.
reason to get back to your veterinarian, ask them about doing a pain medication trial or whether they can identify any other sources of discomfort that may be making it even harder for your animal to cope.
So you're saying that as our pets age, if they're having pain from, say, osteoarthritis, that can actually exacerbate any of the symptoms they're having from other triggers that make them fearful.
That's exactly right. That is
Okay.
exactly right. And it's often unrecognized, especially if we're not seeing, overt limping, lameness, or yelping
Hmm.
or other acute signs of pain. Sometimes it sort of creeps in there and
Yeah.
we don't always recognize it. So doing that evaluation can be super helpful.
Yes. Just one more reason to make sure you are consistent with those wellness visits. And as your pet gets older, that you are doing the senior wellness visits, which typically are more frequent, like twice a year, typically.
Exactly.
Okay.
Exactly.
Well, Dr. Pachel, this has been fantastic. I mean, I've learned some new definitions, the big feelings that I'm gonna use. I'll give you credit, of course, but but when you are dedicated to educating on a topic like fear, stress, and anxiety, you do start to look for new ways to explain it. Like, and I love that you used I think you used emotional distress on your website too. But really helps, I think, we humans understand better from our perspective of how we feel when we're distressed, and that's often really the what your pet is going through.
Yeah, absolutely. And leading with that empathy and kindness to really try to understand what they're going through and how can we support them is so
Yeah.
important.
Well, I want to thank you. We've got your website up, drpachel.com. You've also got the animalbehaviorclinic.net in Portland. Um, and is there anywhere else we should connect with you, Dr. Pachel, if we're interested in knowing
Start
more?
there. Drpachel.com will get you, that'll get you to everything that I touch in the
That's
world
the
out there.
gateway.
It's the gateway to all things me. So yes, and all of the
Right.
interventions that we've got available and the podcast recordings and all of that, it's all linked there.
Fantastic. Well, again, we appreciate your time. We know how busy you are. We know you've probably got patients waiting to be seen, so we don't want to keep you any longer. Thank you for the work that you do and for your deep dedication to our beloved animals. We all appreciate you.
You're certainly welcome. It's a joy to be a part of this journey for so many families and their pets. Thanks for having me on.
My pleasure.